meeting, April 1st, 2020, and the first thing we need to do, since it's a call-in meeting, is some attendance. Probably the easiest way is perhaps we can start with Director Murphy, state his name, and we can work our way towards Christine and our normal positions at the meeting. So why don't we start? Bruce?
Yes, Bruce Murphy, Director of Health, present.
Christine Slack, Board of Health Secretary.
Anyone else there? Eric Weston?
Hi, this is Mary Craig.
This is Hillary Bosky. Charlie?
Did Eric check in? I missed that.
I believe so. Eric, you there? Why don't you state your name again? Someone can hear you.
Eric Weston, present.
Oh, thank you.
Full board is available.
I didn't hear Charlie. Are you there?
Oh.
So we don't have a full board.
Okay, I'm sorry.
That's okay.
Deborah?
I'm here, Christine.
Okay, hi.
Bye.
So we can start. Let's Bruce. You know something that Charlie's not coming, is coming, or what?
I did talk to him this afternoon, just before the meeting. He had the call-in number, and he said he would be calling in at 5.
Why don't we give him another 2 minutes?
Okay.
Okay, I guess not. Everyone's still there?
Yeah, I'm still here.
Just want to state your name?
I beg your pardon?
Away from. Okay, it sounds like Charlie's there. Okay. First item on the agenda is public comment. And anyone who wishes to comment, please just limit your comment to 30 seconds. It will allow us to hear from everyone. And we have about 10 minutes allotted. So, anyone calling in out there?
Hillary, who is supposed to be speaking now?
Well, this is the open or public comment, and this, I believe, was set up tonight. If someone from the public wanted to call in to ask the board any questions, this would be their opportunity.
Okay, gotcha.
Thank you. Yeah, any questions, Christine, just speak up.
Not that I know of, no.
Doesn't sound busy out there.
Not really.
Another 30 seconds. Now we'll move on. Okay, that's fairly close to 30 seconds. Let's go on to the second item on the agenda then. This is the coronavirus update. Director Murphy, anything to tell us, or maybe the latest stats that we have from the community?
Yes, Board, Chairman and Board. As of today, the coronavirus stats in the town of Yarmouth, we have 23 positive cases. We received 6 positive cases yesterday, and we have 3 positive cases today for a total of 23 positive cases.
That's quite a jump in 48 hours, unfortunately. Anything
I have
else?
a question about contacts.
Sure. We're all listening.
I noticed that it's also 23 contacts, which is how many contacts are some of these? What's the range of contacts that the positive folks have had?
Are you talking about tiers? In other words, how far removed from the primary person or the person who was tested positive?
How many contacts are being followed up per person? Just the range. Is there a positive person who only had 1 contact, or is there a positive person that, the lowest number was 3 and the highest was 10? I'm just trying to get a feeling for how many contacts each positive person.
Yeah, I think the highest. I'm sorry. Yeah, I think the highest we have is probably a family where there is 1 person tested positive and there are 3 other people in the household. That's probably the largest we have. Bruce?
Okay.
Bruce, do we have any that are larger than that? Bruce, you still there? Bruce? Why don't we try with attendance again, make sure everybody's still listening. Deborah?
I'm here.
Okay. Mary, obviously you are. Eric, you there? I'm here. Charlie? Yep, here. Okay. Does anyone hear Bruce? I didn't hear him. I don't hear him.
No, I think we lost him.
He got cut off somehow.
We'll probably call back in.
Okay. The agenda is short, so we'll do okay. Let's give it a minute.
There he is.
Bruce now?
Yes, you're on? Bruce? Director Murphy?
All right, I'm back in. Can you hear me now?
Oh, very well. Welcome back.
Thank you.
Okay. Once again, we're on item number 2 of the agenda, and that was the coronavirus update. What we have now is to discuss a order that was written off, essentially an emergency order to protect public health. You all had a copy of it, I assume, and had a chance to look at it. If not, please do so now. And it's really to discuss the items or the measures that the Health Department and the Board of Health has taken. I essentially was representing the Board of Health, and Bruce essentially was in charge for the Health Department in writing this order up. And it's really a list of activities that we have addressed. There are 4 main ones. And under number 4, emergencies, there are a number of items listed. And all of these measures have gone into effect except the last one, which was raised beach boardwalk, that was proposed at the last meeting. Not the board meeting, but it was the meeting for the COVID response team. So, why don't we discuss it with people who have any thoughts about the order, how it was written. It certainly needs to be voted on tonight, and if it passes, then it would certainly be presented tomorrow night at the Board of Selectmen. So, anyone have any comments or discussion? That would be helpful.
Just correct health, public health. That's just a typo. That's all. So it's HEALTH. And I don't have any comments because basically these are things, except for Grays Beach Boardwalk, that have already happened, correct? And this is just formalizing the actions that the health director and the board have taken, correct?
That's correct. I mean, one request I have for everyone is just state your name. I mean, if the public's listening, they probably would want to know who is speaking. That's all.
Okay.
Mary, that was you?
This is Mary Craig.
Great. Thanks a lot.
Yes, that is correct, Mary.
Okay.
Hi, it's Deb. I've read it, and I noticed we had the addition for Governor Baker's instructions about persons traveling to Massachusetts from out of state to self-quarantine for 14 days. And we would be adding that as well.
Deborah, no, it's just the way it was sent out. That really is a separate item for the agenda, and that's not something you have to get voted on. Yeah, so we'll address that momentarily, but no, you can basically, that order, and it's one page, and that's it, looks like, and it's just your signatures at the bottom. That's all there is.
Oh, I see. Okay, I thought that was to include the other piece. All right, I'm glad I asked.
If the board goes forward, this is Bruce, the director, if the board goes forward approving this tonight, this order would go in effect as of today, April 1st. And the board would just be presenting it, the board's action, to the selectmen tomorrow night. That is stated down at the bottom of the order. The order is effective April 1st and shall remain in effect until the state of Massachusetts emergency is terminated by the governor.
This is Mary Craig. Under F, parks, that includes playgrounds also, correct? Are they all parks in this town anyway?
This would be the town parks. Yes, some of them have playgrounds, some of them do not.
Okay.
What about school? I'm sorry, this is Deb Brunis. What about school, playgrounds?
The schools' playgrounds and property fall under their school. They have taken a similar stance on closing their playgrounds.
Okay.
I would recommend, Chairman, at home, once the board finishes discussion, would be to read the full order so people at home or listening could follow along.
Absolutely.
Would you like me to read it?
Well, yeah, I think probably we need a motion, that the Board of Health accepts and approves the order. That would probably be necessary before it's read, going to vote on it. But sure, if you'd like to go ahead, that'd be great.
So do we need to make a motion that we approve it, and then you want me to read it, or you want me to read it first and then we'll vote on it?
No, at the end. In other words, just instead of just reading it, it'd be helpful to say what we're reading. In other words, if we're really trying to make a motion that our board is accepting and approving the order, and then read the order and vote on it and see how the vote comes out, obviously, whether it passes or not. So, yeah, just to say what we're doing and then reading the order.
I move that the Yarmouth Board of Health.
Go ahead.
I move that the Yarmouth Board of Health approve the emergency order to protect public health as read by Deborah.
I second, and I'm delighted to read it. This order is being issued pursuant. Yes, Bruce? Yeah. Sorry? It's probably just my feedback. This order is being issued pursuant to the emergency authority of the Yarmouth Health Agent and Yarmouth Board of Health to protect the public health and safety. The Board of Health finds that there is a number of confirmed COVID-19 cases within the town of Yarmouth, and that data and studies available to the Board of Health demonstrate that there is substantial risk of transmission of the virus, and that unabated access to and use of buildings and public and private space exacerbate the risk of transmission. This order is to reduce the risk of COVID-19 transmission and to abate a public health risk. The spread of COVID-19 is recognized by the World Health Organization, the CDC, Center of Disease Control, and the Massachusetts Department of Public Health as a pandemic. This order is issued under authority of Massachusetts General Law, Chapter 111. The order affects the following activities. Town buildings closed to the public. Senior Center is closed except the kitchen for Meals on Wheels and food programs. All town libraries are closed. All town recreational activities are closed. These include golf courses, pickleball courts, tennis courts, basketball courts, youth activities, parks, beaches, and Grays Beach Boardwalk. It is further ordered that there shall be no self-service coffee, drinks, or food in retail stores. The order will be effective today, April 1st, 2020, and shall remain in effect until the state of Massachusetts emergency is terminated by the governor.
Thank you. So why don't we, just for the record, is there any discussion, first of all, at all, about what we're doing, so it's clear?
This is Eric Weston. There's just would like to say, as we probably know, there's no shortage of feedback from people in the town and as well as the Board of Selectmen with regard to closing the beaches. And I'm not really commenting either way on that, just that people seem to be taking that to heart. With that being said, obviously these are unprecedented times. And, my experience in driving around has been that I have seen people congregating at the beaches. Obviously, that's something we would like to avoid and strongly discourage. So I'm not sure if there's any other way to strongly discourage it other than by closing the town beaches.
Okay, I appreciate that. I mean, I'm obviously just trying to give every opportunity here before we vote on this, and that's why I'm just trying to be careful here before we're going to vote on this.
How is the select board looking at this now? I know how they looked at it last week, but how are they looking at it now? Any differently?
Well,
have you heard anything from
no,
them
I don't think. Okay, I don't think we're going to discuss that right now. Okay, I think we can. I'd rather vote on the motion and to see whether or not we're going to present that to them. But certainly, it's on the agenda just to talk about the upcoming meeting. I think I'd rather just vote on the motion. So why don't we go ahead and just all in favor of passing the motion, just state your name.
Mary Craig.
Deborah Burnich.
Eric Weston.
Hillary Bosky. Anyone against the motion? I didn't hear a vote from Charlie. Are you voting for or against or abstaining from the motion? For it. Okay, so we have 5 for, so it's unanimous and it passes. Thank you, everyone. Okay, good work. Bruce, thank you. It's a lot of work on your part putting this together.
Thank you, Mr. Chairman.
Okay.
Mr. Chairman, that was a unanimous vote, correct?
Yes, it was.
Correct.
Yeah.
Thank you.
Okay, thanks, Christine. Okay, third item on the agenda, and that's the meeting with the Board of Selectmen, and that's tomorrow night, Thursday, April 2nd. Director Murphy, anything that you want to say about this upcoming meeting?
No, we're on their agenda at 6. They're going to have an update on the coronavirus, I think, from the town administrator, what all the various departments are doing. and they'll ask for an update, which I can give them. And I see on their agenda they have discussion of the beaches, so the board members can call in, and you and I can present the tonight's motion order to them.
Okay, thank you. Now, Mary, you made a comment just about this, so
I was just curious if there had been any more feedback from the Board of Selectmen about the beach closure since their meeting last week when they declined to support the closing of the beaches by the Board of Health and the Health Director.
I personally, this is Hillary, I personally did not receive any phone calls or emails from them.
Okay.
Director Murphy, did you hear from them at all?
I have not heard from them individually or by email.
Okay.
Mr. Chairman, Deb Brunage. I just read that sorry? I just read that Falmouth closed their beach parking lots and Dennis is considering closing their beaches.
Right.
I just thought I would share that if anybody was unaware of it.
Thank you. Yeah, it says something about what we're attempting to do, I guess. Rather proactive here. So thanks for the information. Anything else? I mean, Bruce, were we invited or we were asked to present for tomorrow night? It wasn't clear to me exactly. I know it was
the board was invited to attend.
Okay.
It's a Zoom meeting. It's a Zoom meeting. I will get the agendas out to everybody so you can have the call-in information.
They didn't formally ask for a presentation then?
Correct. They just asked. Correct. That's my understanding. But they do want us there to give a discussion. I believe a discussion with them.
Okay, that's great. If any of the Board of Health members can attend, I know people are working. If they can, it's the 6 o'clock meeting on gender. This should be a time when we're probably going to be on for the coronavirus update and for the beaches. You could probably call in later if you didn't want to attend for the whole thing. Anything else?
So that will be, that will be probably first on the agenda, do you think?
I believe so. They have the selectmen have executive session first at 5:30. Then they start at 6 o'clock public announcement. So we would come in at 6.
Okay.
Thanks, Bruce.
I believe you should have all had the agenda, but I will send that out to you also with the information to get on the meeting with.
Thank you.
The other last thing, Mr. Chairman, is I didn't know if you wanted to read that Governor Baker's on the in-state travel from out of state.
Yeah, absolutely. Yeah, basically the Board of Health was asked by the town manager to make a public statement on Governor Baker's instruction for people traveling to Massachusetts. So I just put together a simple one-sentence comment on it, I guess. This is not an order. It's not something we have to vote on, but if someone is asking the stance of the Board of Health, this is what we're, if everyone agrees, this is what our statement is. And essentially, it's the Yarmouth Board of Health supports the decision made on Friday, March 27, 2020 by Governor Baker instructing all persons traveling to any part of Massachusetts from out of state to quarantine for 14 days to avoid the spread of COVID-19. And so I'm time for some discussion. People support a statement from the Board of Health, or they want to reword it, or how they feel about in general.
I think it's fine to say that because I know that I have been hearing comments from people about out-of-state people coming onto the Cape and the concern about that from the standpoint of maybe bringing in some virus load that isn't here already, although it's here, and also straining the resources that we have here on the Cape. So I think it's important that we do speak to the issue, and that we do it the same way the governor of the state did it, because there's certainly people, as we know from the letter that Bruce had forwarded to us, that have some even stronger ideas about keeping people off the Cape. So I think it's prudent for us to make this, to acknowledge this and support it.
Yeah, I mean, the numbers are skyrocketing in New York, New Jersey, and now Connecticut. And you do see a lot of license plates in those states.
Yes.
I certainly have seen them on the roads recently here on the Cape. And it's not only food and cleaning materials, it's also the hospital. It's a concern,
Exactly.
obviously. We have 2 moderate-sized hospitals here. So, all right. Any other comments? If not, we'll keep it as a statement if someone is asking us, or it'll probably be Director Murphy that he asked about it. No other comments? Let's move on. Mr. Murphy, that's all I have on my agenda listed. Is there something else that we need to address tonight?
Not tonight at all. We're good.
So usually at this time, we often, if someone's interested in leaving, they'll make a motion of some sort to adjourn. If anyone wants to do that, they can now.
I'd like, Eric Weston, like to make a motion to adjourn.
Is there a second?
Second.